following interview involves commercial content. The products and services featured appear as paid advertising.
For nearly 60 years, Longmont United Hospital has been providing award-winning health care throughout Boulder, Weld, and Larimer counties. LUH is a full-service hospital offering everything from cancer care, women's health, orthopedics, robotic surgery, neurology, extensive primary care, and specialty physician group with clinics throughout the area. Now with us today from the Travel Medicine Clinic is Longmont, Dr. Patricia Gill and her physician assistant, Kari Schoenwald. Both Dr. Gill and Kari have a combined 30-plus years in infectious diseases and travel medicine. It's nice to have you here, ladies.
Thank you for having us.
Explain more what you mean by travel medicine, Dr. Gill.
Well, in a nutshell, travel medicine just has to do with caring for the health of the international traveler, both before they leave and after they return. Our goal is to prevent them being sick at all, but we're able to take care of them if that should happen.
And that's the whole reason why they should actually seek out medical services before they leave.
Exactly. We think about the individual needs of the traveler. We look at their itinerary, what their own personal health history is. Many of our travelers are business travelers, but we also see those who are on vacation, those who are studying, doing semester at sea, studying abroad, those who are doing relief work or a mission trip, and all those people have different needs, and so we try to consider that along with whether they're in a special circumstance, like have a personal health problem or are pregnant or considering pregnancy.
Right. And Dr. Gill touched on it a little bit there. Kari, explain to me, besides helping travelers with just infections, what else can you help the traveler with?
We have travelers that do several different activities when they travel. Some are more risky than others. Oftentimes travelers will be trekking at altitude or doing deep sea diving. We can prescribe medications that might help with altitude sickness, as well as ear drops for potential ear infections while someone is diving. We have a full-service laboratory that if people need lab work before some of the immunizations or for other reasons before they travel, we can arrange for that as well.
You mentioned deep sea diving. Oh my gosh, my husband does that and he wants me to do it. I'm like, I'll stick to a pool, thank you. That's about as deep as I'm going to go. How soon should we come to see you before we actually travel, doctor?
4 to 6 weeks is a good time to shoot for.
4 to 6 weeks before we actually make the trip. Okay, and what are some tips? How can I get the most for my travel?
Well, that's an important question. Most important is come prepared. Bring your itinerary, the dates that you'll be traveling, your personal health history and medication list, and your vaccine record, so we can bring up to date whatever's necessary.
Now, if I get the immunizations and I take preventative measures with medicine, does it make it an absolute that I'm not going to get sick?
Well, no, it won't make it absolute, but it is about risk reduction and mitigation. And we can offer different types of vaccines like yellow fever, like hepatitis A and B, and tetanus immunizations that can really lower the risk, as well as give malaria prevention that would also lower risk for mosquito-borne illnesses.
Okay, and now because we're talking international travel, you actually brought a map here which is certainly helpful. Let's start with the Eastern Hemisphere and go into details about what we should be concerned with.
Well, this map shows the countries that are endemic for malaria in Africa, and you'll notice most of Africa and most of Southern Asia are places where malaria is a risk. There are a few patches that are not, and you'll notice that every country is totally shaded if there's any malaria, so we can look at areas within the travel plans and adjust as necessary.
And focusing more on Africa, what should we be concerned about for that continent for travel?
This map shows us the yellow fever areas in Africa, and many of the same areas are involved as our malaria risks.
And let's move to the Western Hemisphere. What should we be concerned with?
This shows areas of Central and South America that, again, are malaria endemic. And if you want to show the next one, that shows us the areas of the yellow fever risk, which is mostly the Amazon Valley.
Okay, and I just want to give out your phone number really quick because you could reach out to Dr. Gill and Kari, and if you're planning on traveling, I know the kids are out of school in a couple of weeks, make sure you do that. Like she said, 4 to 6 weeks out is the best to get your immunizations. 720-652-8400 is the number to call. Mention Colorado and Company, or of course you can log on to their website, which is luhcares.org, luhcares.org. Okay, now what's the biggest thing to know about South America in regards to travel and medicine?
Well, South America is a big continent with some tropical areas and some more temperate areas. And so we think about malaria risk, we think about yellow fever in the Amazon basin. We think about hepatitis A, hepatitis B, depending on whether the person will be there for an extended period of time, and we try to protect against those things. We also try to bring up to date any childhood immunizations or routine immunizations that the person might need.
So with everything that you mentioned, how are you able to prevent people from getting infections?
We give immunizations against some of the infections like yellow fever, hepatitis A. We use preventive medications for malaria prevention, and we usually provide our travelers with an antibiotic to do early self-treatment for travelers' diarrhea.
Good. Okay, so what happens if I get sick during my travel or maybe even coming home?
Well, contact us. We have a full-service lab. We are, as infectious disease specialists, we're able to diagnose and treat infections that might occur.
Kari, how are you able to stay so current on everything that's happening across the world?
We have several ways to stay current. We do participate in routine continuing medical education. We are board certified in our fields. We also are part of email list services or groups that update us daily on emerging infections throughout the world. We review websites quite often, including the Centers for Disease Control, World Health Organization, and our public health departments. And we are members of the American Society for Tropical Medicine and Hygiene.
Good, excellent. You know, just last week we had a couple on the show that they were going to travel to Nepal to help those who are suffering from the earthquake. Do you have any suggestions there, medical-wise, preventative care?
Well, that's an area that will have some diarrheal illnesses, some mosquito-borne illnesses. Updating their vaccines for tetanus is an important step to take to keep them safe, and so seeing a travel medicine specialist before they go will be helpful.
Right. And again, the best 4 to 6 weeks out before you leave.
As soon as possible.
Thank you, ladies, for coming on. Important, valuable information. Your adventure should be thrilling and risky. Your health should not. Let Dr. Gill keep diseases from getting in the way of your travels. You can call today to schedule an appointment at Longmont United Hospital's Travel Medicine Clinic. Here's that number, 720-652-8400. Again, it's 720-652-8400. You can also visit their website at luhcares.org. Longmont United Hospital paid for today's appearance.